When medical emergencies and other crises happen, the focus is on the care recipient and getting them the medical care they need. A visit to an emergency department often involves waiting a long time to be seen by a nurse or a doctor. It's probably going to be stressful. Looking for documents and medication or trying to recall details of their medical history during an emotionally charged situation may be challenging. It is wise to have a plan, like having a pre-packed bag ready for your care recipient that you can grab and go in case of emergency. You should consider bringing the following items. A list of medications. Include the pharmacy's phone number if you're using one pharmacy. Medical history notes, including any specialist doctor's names and phone numbers. A change of warm and comfy clothes and slippers. An old pair of glasses and hearing aids. A copy of the power of attorney. A phone charger. An eye mask and earplugs. Lotion for dry skin. Lip balm for dry and chapped lips and saline nose spray. A book or magazine. A water bottle and snacks. It is also a good idea to have a similar bag packed for yourself too, and be prepared for what may be a long wait at the emergency room. Identify yourself to the ER staff as the caregiver and let them know if you are the substitute decision maker or power of attorney, so you can be kept informed and included in decisions. Having the pre-packed bag is also useful in the event your care recipient is admitted to the hospital. If this happens, it is important that you again identify yourself as the caregiver to the hospital care team in order to be included as a member of the patient's care planning team. You need to familiarize yourself with the hospital's policy for visitors. The hospital provides care 24 hours a day, so know what the rules are about visiting and staying overnight. If needed, have the doctor write an order that allows you to be with the patient at all times. As an advocate for your care recipient, it is important to remember that hospitals can also accommodate special considerations based on the unique care needs of the patient. Every hospital has a patient relations department that can assist with these special considerations and facilitate your access to your care recipient so you can provide support. These departments are generally staffed 9 to 5, Monday to Friday. Outside of these hours, you could contact the clinical coordinator on call or speak to the nurses on duty. When advocating for special considerations, it is useful to know that hospital essential visits include visits for compassionate care, including critical illness, palliative care, hospice care, end of life, and medical assistance in dying. Also, they include visits relevant to the patient or client's physical care and mental well-being, including assistance with feeding, mobility, and with personal care. Communication assistance for people with hearing, visual, speech, cognitive, intellectual, or memory impairments, and those speaking a language other than English. Assistance by designated representatives for persons with disabilities, including provision of emotional support. Visits for supported decision-making. Visits for pediatric care, labor and delivery. And visits required to move belongings in or out of a patient's room. Whether at the emergency department or the hospital, you will be asked questions related to the care recipient's medical history. Medical histories and key dates can be difficult to remember and track. However, you should keep notes about the medical history, such as specialists' appointments, diagnoses, medications prescribed, diagnostic tests results, hospitalizations, procedures, surgeries, and have them readily available at the emergency department and hospital. Information about medical history is important for the healthcare team to know. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.